How do you define an effective practitioner? Do you believe that you fit into this category?
I think an effective practitioner, first and foremost, has the client's health and wellness at the heart of their decisions in practice. I also think an effective practitioner is conscious of their own health and well-being, because if you can't take care of yourself, how can you take care of others? There's a huge focus on the therapeutic relationship. This must be nurtured. Being our authentic self is very important. Owning my processes without defensiveness and building rapport with the client through warmth, acceptance, and self-awareness.
What roles does effective communication have in a clinical practice, good or bad?
It's absolutely good to have effective communication. Without it, a depth of knowledge is lost required to build the therapeutic relationship with the client. The therapeutic relationship is an interactive one. A practitioner needs to ask the relevant questions to a patient, and the patient needs to be comfortable relaying usually very personal information. This communication will produce an effective consultation for all parties involved. It's important to be mindful when communicating, such as asking ourselves, what is my intention? What effect might this communication have? Or is the communication clear and specific? Be aware of not just verbal communication, such as listening, reflecting, and question types, but also non-verbal communication. This includes body language and facial expressions.
Thinking about the types of conflict, interpersonal, social, and personal, what is important to think about when managing these?
Conflict is something that's bound to come up at some point in my career, and it's incredibly important to have these strategies in place when I encounter conflict. Having a harm minimization plan ready when dealing with an angry client. I'd use tactics such as identifying and controlling my feelings in the first instances, then acknowledging the client's feelings and using direct, calm language. Also, emotional intelligence can play a large role in preventing potential conflict, a skill I feel I've acquired naturally over the years. Also, after the incident, a practitioner should review their conflict resolution process to evaluate the issues and resolve with the least damage possible. Also, being aware of professional boundaries and possible crossings over that might happen between yourself and the client.
What are some essential skills required for a healthcare practitioner?
Overall, I think you need to be aware of how you communicate to your clients. Without even realizing it, people can pick up on the smallest details, so I think it's so important to be mindful of that. Be a good listener. Again, being aware of non-verbal communication like body language. Be clear and concise with questions and treatments. Make sure you bring the client along the journey with you. This is crucial. Show confidence, but be personable and remain open and empathetic towards them. I think all of these skills help with the therapeutic relationship.
Yeah. How would you approach a situation where your client has drastically different values and beliefs than you?
I think in this situation, it's important to realize your values, needs, and feelings, and when they might be popping up with a client, a friend, or even yourself, and acknowledge it. I think preconceived views have a negative effect on the client that might not be salvageable. I think it's our responsibility to own our personal and professional development in terms of self-awareness, and remember to be mindful and present.
How do you approach self-care? Meaning, what do you do to help take care of yourself or reflect on your day?
I truly believe that if you're not taking care of yourself, how can you possibly be your authentic self and assist with other people? I love going for walks. I love moving my body, observing nature, getting some vitamin D. It just brings me so much joy. I've also recently become very interested in skincare, which just makes me feel so good, and I look forward to it every day.
Do you believe that you need to grow in any areas of your knowledge, from personal to clinical and educational?
I think you never stop growing and learning in life. This rings true to my personal life and my professional one. Otherwise, you become narrow-minded, which is not the type of practitioner I want to be. learning is something that motivates me. It's something that I value very highly in my life, and I also think it's a strength of mine knowing this. One area I would love to keep learning about is the vast number of different native herbs to different regions across the world.
Yeah.